Hey everybody, welcome back to Pick Dr. Osborne's Brain. We've got a great show for you tonight. I've got just a really excellent set of resources for you on this topic. Tonight we're going to be talking about hormone disruption in a very, very big way. And a lot of what I'm going to be talking about, we've got medical references, so make sure you we'll put that link in below the show notes so you can go and access that information. And we're really going to be doing a deep dive as well on gluten sensitivity as gluten relates to causing hormone disruption. And if you're new to the show and you're not quite sure whether or not you should be on a gluten-free diet, if this is like new news to you, newsflash, and you want to learn more, check out, I'll put a link down below here where you can take a free quiz online. It's just a few questions. You go through it and answer them. And if you answer enough of the questions in a certain way, then there's going to be a stronger likelihood that you might want to go and talk with your doctor about doing a deeper laboratory investigation as to whether or not you have gluten sensitivity, or you can do genetic testing. Genetic testing really, in my opinion, is the end-all be-all for helping us to identify whether or not we're going to react to gluten. And so again, you can learn more about that in the link below the show. So welcome back. It's another great Monday night episode for you. We're going to be talking all about hormone dysfunction. And we're going to be doing kind of a deep dive on several different hormones. And so let's start with, I'm going to throw up a diagram on the screen for you because when we talk about hormone dysfunction, what does that really mean? That's kind of a vague term. It's kind of broad, right? There are a lot of different hormones, from estrogen, progesterone, cortisol, insulin, testosterone, DHEA, insulin, again, thyroid hormone, adrenal hormones. So we've got all these different hormones, but I want to talk about some of the most common symptoms that are seen associated with hormone disruption. So if you have anything on this list, again, you might consider yourself to be suffering or struggling with a hormone issue. So going through these symptoms, painful and irregular periods. Ladies, if you are having painful cycles where you have to find yourself popping naproxen or ibuprofen before your cycle, first of all, you should understand if you take non-steroidal anti-inflammatories, they can actually cause leaky gut and intestinal bleeding, vitamin C deficiency, folate deficiency, iron deficiency. So if you're finding yourself month after month having to pop these pills to control the pain around your cycle, know that you could actually be helping to increase a leaky gut and further or future autoimmune problems. And you really want to find out the bottom or the root reason as to why you're struggling with pain during that time. But that's a major symptom of hormone imbalance, is painful or irregular menstrual cycles. Another symptom, infertility. This is a big one, infertility. So let's just start at the top here. Painful menstrual cycles. Number 2, infertility is a very common symptom associated with female imbalance. And this could be male or female infertility. And I've seen cases where the man and woman would come to see me and it wasn't the woman. Usually the women get blamed on fertility problems. In some cases, actually the men had, sometimes it's an inadequate quantity of testosterone that leads to poor sperm formation or poor sperm motility. And so sometimes it's the man's fault too. And so hormone imbalance, if you are struggling trying to have a baby, you and your husband or you and your wife struggling and you haven't looked into this could be a big, big factor into that. Low libido is another one. So a lot of these kind of falling in under the same category, but low libido, no sexual desire, could mean that you have hormone dysfunction. Headaches are very, very common. As a matter of fact, there's a type of PMS called PMS-H, the H standing for headaches. Another type of PMS is PMS-A, the A standing for anxiety. This is another symptom of hormone dysfunction as well. We've also got a PMS-C, which stands for craving. So if you're one of those around your cycle, you crave a lot of sweets, that might be you as well. So painful periods where there's anxiety, where there's heavy craving, where there's headaches. Let's put an A in after that. Those, again, symptoms of potential hormone imbalance. Weight gain. If you struggle either with weight gain, meaning you're putting weight on, or you struggle keeping weight on, either one of those could be a hormonal dysfunction or hormonal imbalance. And this goes to those of you who are putting on more fat. that could be part of the problem. And it could also be that many struggle to lose weight because they can't put on muscle. So they try to work out and they're not actually putting on muscle. So they're not improving their metabolic function as a result of increased muscle density. So if you struggle with gaining weight, and again, muscular weight, even though you try to work out, again, hormonal imbalance could be at the root of that. Big shifts in mood. So mood swings, agitation, irritability. You know, and we're talking about severe swings where, you know, men might get ragingly angry, women might get very unreasonable and angry, depression associated with these mood swings as well. All those can be part of a hormonal imbalance. We've also got sleep issues that can arise as a result of hormone imbalance. So trouble sleeping or insomnia, trouble staying asleep, waking up in the middle of the night. You know, falling asleep okay, but waking up in the middle of the night could be a hormonal type of symptom or dysfunction. Skin problems. So we mentioned sleep. We're going to mention skin. A lot of times what we'll see is mysterious rashes. We'll definitely see dry skin, especially as it relates to thyroid hormone and estrogen and progesterone. But we'll also sometimes see skin rashes occurring as a result of hormone dysfunction as well. Brain fog, poor memory, cloudy thinking, or loss of the ability to recall words. This is oftentimes associated with low hormone output or poor hormone function. Hair loss. Just make a column up here. So brain loss, and I say brain loss, I mean brain cognitive loss. Hair loss. And I'm not talking about the standard hair loss. Women, sometimes you will ask me, Dr. Osborne, I'm losing my hair and I feel like it's coming out more than it has been in the past. There's cyclical loss to hair where you're going to see some natural hair loss in the shower, and then there's clumps of hair coming out. Very different thing. Typically those big clumps or excessive hair loss where you notice your hair is thinning, that oftentimes is linked to a hormonal imbalance as well. Several different hormones can cause trouble with maintaining good hair. I mentioned anxiety before. I also mentioned depression. Now, I drew this in up here, but really anxiety and depression, even if you don't have premenstrual syndrome or what some doctors call premenstrual dysphoric disorder or PMDD, you could just have anxiety frequently. It doesn't have to be necessarily around your cycle. Same thing with depression. You could just have depression frequently. It doesn't necessarily have to be around your cycle. Hot flashes, another big one. Hot flashes, again, this is a very common one when women are going into premenopause, perimenopause, and then further into menopause. Hot flashes can be a very, very common side effect when estrogen levels and progesterone levels really start to drop. So also symptoms of hormonal imbalance. Muscle aches, not recovering. Not recovering from a workout. So you go to work out, you find that your muscles hurt, you're sore all the time, and you're not really recovering very well. This is a very common manifestation of hormonal imbalance. And then as well, we have bowel dysfunction. So things like constipation, symptoms like constipation or IBS can also be hormonal dysfunction as well. So if we look at, again, if you struggle with any of these things and you're not quite sure why, maybe you've got a lot of these things, maybe you've got more than one of these things going on, and you've gone to your doctor, right? You said, okay, hey, I'm in the doctor's office. Hey, doc, I have X, Y, Z, pick your symptoms. And the doctor pulls out a prescription pad and says, you have muscle aches and pains, let me give you some naproxen. Oh, you have hot flashes, let me give you some estrogen. You have anxiety and depression, let me give you a drug for that calms you down, like a sedative or an antidepressant like an SSRI. Or hair loss, let's try some over-the-counter Rogaine. Or brain or cognitive dysfunction, let's try some Vivarin or some let's try some stimulant medications, the same kinds of meds that doctors oftentimes give for ADD or ADHD, they'll give for cognitive dysfunction. Skin rashes, oftentimes they'll give you steroids. Sleep, they'll give you sleep medications. Mood swings, again, they'll give you the SSRIs or the mood-altering medications. Low libido, oftentimes they'll give you hormone therapies. Infertility, lots of hormone therapies especially if you go to see an infertility specialist where you're trying to have a child, and then again, painful PMS, mostly pain medications around that, or birth control pills. A lot of women get birth control pills when they have painful cycles. And what I want you to understand, if you're listening again and then you're new to the functional line of thought, is that taking medicine to reduce symptoms without understanding where the symptoms come from, in my opinion, is never a good idea, because you don't actually solve the problem. What you end up doing is you create the need for the rest of your life to stay on a medication. And when you do that, it's a false sense of security, or it's what I call pseudocompassion. It's not really compassionate to take medicine to reduce symptoms when you don't know why the symptoms are there. And so what we really want to understand is why these things are happening, and that's why we're going to be talking about hormones tonight. So I'm going to throw up another diagram for you here. We're going to dive into the actual list of hormones that I want you to understand. Now, again, if you are new to the show and you don't know much about gluten, what I want you to understand is that gluten can cause hormone disruptions in every one of those hormones that you see there on the screen. So your sex steroids, like your estrogen, your progesterone, your testosterone. You also want to understand that it can cause disruption in your stress hormones. That's your cortisol. Your insulin. Gluten can disrupt your insulin. Ladies, gluten can also, during pregnancy, can disrupt your prolactin. I see sometimes women come to see me and they've been told they have something called hyperprolactinemia, or elevation in the hormone prolactin, so they get put on medication to suppress the production of prolactin, not even knowing that gluten may be playing a role in it. So gluten, we look at as a reason why hormones can become abnormal, can affect cortisol. It can affect insulin. It can affect estrogen, progesterone, testosterone. It can affect your thyroid hormone. It can affect prolactin. So this is the list I'm going to go off of tonight. Now, there are more hormones than these ones I've got listed here, and we certainly could dive deeper into more, but I want to kind of stick to some of the core ones, because these are some of the bigger ones that we'll see creating a problem. So let's talk about it. So really what I should say is not just gluten, but I should say gluten/grain. Okay, because it's not just gluten. Gluten can cause hormone disruption, but so too can grain consumption, aside from the fact that, whether it has gluten. So there are elements to grain, right, that can do this, but then gluten can also cause hormone dysfunction. So let's just start at the top here. Cortisol. One of the elements that we know is that gluten acts, when gluten comes in, it causes an inflammatory response. So we get inflammation. And then inflammation, understand that cortisol is how your body fights inflammation. So what that does initially, when you are early on in your life, as you're eating gluten, and that gluten is creating an inflammatory cascade, early on your cortisol increases. But over time, as you don't recognize it and you continue to eat gluten, over time your cortisol drops. Okay, so this is with time. Your cortisol levels drop. And when your cortisol levels drop, what happens is the inflammation becomes more pronounced. You increase the perception or the way the inflammation is actually affecting you. In essence, remember, cortisol fights inflammation. This is why if you go to the doctor, a lot of times, especially if you've got like chronic pain, like a shoulder issue, like a frozen shoulder or a knee problem, what do they inject into your joint? What they generally will inject is what's called a corticosteroid. And a lot of times, maybe they won't inject it into your joint. Maybe they'll give you what's called a Medrol dose pack, or a steroid dose pack, where you take steroids at high doses, and then over a period of 7 to 10 days, that dose tapers down. What they're actually doing is they're giving you a form of artificial cortisol to fight the inflammation, right? Instead of addressing where the inflammation comes from, they're drugging you with something unnatural to fight the inflammation for you. Now, again, if you are eating gluten and that's driving up your inflammation, and over time reducing your body's ability to keep up with the inflammation by making enough cortisol, what ends up happening when you take that artificial cortisol is you get some relief, because cortisol is a very strong hormone and it can work really effectively and initially at reducing pain and inflammation. But what happens with the steroid, with cortisol, so when you take the medicine itself, it actually leads to reduced muscle. So you get muscle loss, you get bone loss if you're on steroids for long periods of time. So many of you may be taking like low doses, 2.5, 5 milligrams of a corticosteroid on a daily basis. I've seen some doctors do this where they just put you indefinitely on a corticosteroid. You have to understand that steroids also cause immune suppression. So they predispose you to developing chronic degenerative problems, but also predispose you to developing infection through the immunosuppression. So again, you use that cortisol artificially. These are the side effects. Now, nutritionally, cortisol causes vitamin D deficiency and magnesium and calcium deficiency and zinc deficiency, and that can create big problems. So again, the gluten-induced inflammation is what affects the cortisol. Initially, in the beginning, it increases it, so we might get an elevation, but over time, it actually depletes your adrenal organ reserve. And so over time, your ability to produce cortisol to match the inflammation caused by gluten is diminished. And so again, this is one route that many people take. They just don't know of another route, so they go that cortisol medication route. But really what we should do in this scenario is we should not go cortisol, but we should go gluten-free. And this is part of why I wrote No Grain, No Pain. So those of you who have read the book understand that I wrote in depth about something called the gluten muscle wasting cycle. What you have to understand, I said that cortisol causes too much over time, causes muscle loss. So one of the things that we'll see is a person who's medicated for their pain for long periods of time, their muscles will atrophy. And when their muscles atrophy, what happens, remember, your muscles hold your joints together and allow your joints to move. And when your muscles atrophy, what that does is it compresses the joints so that when you go to exercise, when you go to use those joints are now working under compression because the muscles around them have shrunk. And so it grinds the joints and it creates an arthritic process earlier in your life over time. So when you're trying to work against drug-induced muscle loss, and you're working on joints that are now further compressed because of that muscular atrophy, you can actually, basically what it does is it deters you from ever wanting to exercise. And then subsequently what happens, this leads to not necessarily fat gain, but for many people, I should say not necessarily weight gain, but it leads to fat gain or fat mass gain. Because you lose your muscle and your body fat percentage will start to go up. And then as you have exercise avoidance, you'll gain even more, and then it'll make it a struggle to lose weight. But one of the other side effects, we didn't talk about this, one of the other side effects of long-term steroid use is it increases water retention. And so you'll put on 15, 20 pounds of water. If you've ever seen somebody go on steroids, and maybe you guys have experienced this. Matter of fact, how many of you in the audience tonight have been put on a steroid where somewhere in that vicinity of taking that medication, you notice that your face started to puff up, your hands and feet started to swell up. This is the water retention that can occur as a result of using those artificial medications for too long a period of time. And it can actually happen quite acutely. I've seen people puff up overnight being on steroids. So again, water retention is weight gain. That means more pressure on your joint. Reduction in muscle size means more pressure on your joint. So you multiply the weight of the water times the pressure of the muscle loss, and you definitely don't want to exercise. Exercise becomes too painful, right? And then we gain more fat. And then as we gain more fat, guess what happens? That feeds right back into not wanting to exercise. It feeds back into kind of a sedentary style. So gluten can definitely create an inflammatory cascade that leads to, over time, a depletion of cortisol. Now, there's something else that gluten can do. Let's move on, because otherwise we'll be writing a book about all this. So I got to move on from cortisol. Let's talk a little bit about insulin. So this is more one where it's a grain impact more than it is a gluten impact. A grain is super high carb, so it's very high carb. And that high carb effect, especially wheat is extremely high carb. It's going to lead to an increase in glucose. And that increase in glucose is going to lead to a response. Your pancreas is going to increase the insulin production as a result of glucose. Let me draw you a deeper picture on this. So if we look at the bloodstream, and then we look at, let me draw this out for you. So here's your pancreas. So glucose kind of looks like a stop sign. Okay, and once it hits your blood, it's traveling through your blood. It stimulates a message, so it sends a message to your pancreas. So think about that as if you eat food that stimulates extra glucose. That's step one. It's kind of what you eat. Now, food will do that, but stress can do that too, and that's why chronic stress can lead to so many different problems. So stress can increase your glucose. Interestingly enough, too much stress increases your glucose because this is one of the other impacts of cortisol. When you eat too much grain, it dumps, you know, the inflammation happens, and then that creates cortisol. But remember what cortisol does to your liver. Cortisol actually travels to your liver and tells your liver to dump glucose into the bloodstream. Remember, cortisol is a stress hormone, and generally when people are under stress, it's acute stress, which is a healthy form of stress, not chronic. Acute stress, the reason why cortisol tells your liver to dump sugar is because you need that glucose to generate energy very quickly to escape or to run or to fight, right? That's the whole premise of acute stress. It's the chronic stress when cortisol's elevated for long periods of time, telling your liver to dump more sugar. That's why stress can also increase your glucose. So we'll call this step two, this pancreatic response. And the pancreas responds, we'll call this step three, by producing the hormone insulin. And so now we have this insulin. Now, what is the job of insulin? Every one of your cells on their surface have an insulin receptor. We'll just abbreviate that as IR, insulin receptor. So insulin then will come and it will attach to the insulin receptor. This is kind of like a lock and key mechanism, okay? And then that sends a message through the cell to open up. There's a specialized door on the surface of your cell. It's called a GLUT door. We can call it a glucose door, but its formal name is a GLUT door. And then once that opens, then glucose can come into the cell, and then we can make energy. So all this has to happen, right, as a result, again, of glucose communicating to the pancreas. Pancreas responds by making insulin. The insulin communicates to open this door, and then we can get the glucose from the blood into the cell to make energy. Well, imagine if the glucose is overwhelming the bloodstream. So imagine that you're eating so much, right, that grain, that your glucose level is being driven up. So now what happens over time is you make more and more insulin. So when you have more glucose, you've got to make more insulin. And what happens is the longer you make high levels of insulin over time, you develop something called insulin resistance. I'm going to rename that. So increased insulin over time equals insulin resistance, IR. And that insulin resistance means that you're making more insulin, but it's becoming less effective. It's not doing its job as well. It doesn't open that door as effectively. This is number 6. And so when it's not opening that door as effectively, then the glucose can't get out of your bloodstream. So it gets stuck here. And what happens when glucose gets stuck in your bloodstream? It glycates things. So we get an increase in something called glycation. Now, glycation means everything in your bloodstream becomes sugar-coated, literally sugar-coated, glucose-coated. It's a process where the glucose actually, like syrup, sticks to the other hormones that are floating around in your bloodstream. So this is one of those where when we start affecting insulin in a bad way, we affect all these hormones, right? Because now we start glycating them. Sugar moieties start attaching to your hormones and rendering them less effective, making it harder for them to do their jobs. Just imagine if your hands and your feet were coated in syrup and you were trying to type on your keyboard or you were trying to go about your day-to-day work. It'd be much more challenging if you were coated in sugar. Well, it's just as challenging for your hormones when they're coated in sugar, when your diet, serves to drive this up. Now, a lot of people have learned this the opposite way. They've learned that eating lots of grains is actually good for heart health and diabetes. And I would argue that, and I would argue, and a number of other scientists would argue that this is the furthest thing from the truth is that lots of grain actually drives up your glucose level in your bloodstream, increasing this cycle from breaking down. So again, insulin is impacted as a result of grain exposure because of the heavy carbohydrate. And so those of you, maybe even some of you that are following a gluten-free diet, but you're not following it correctly, maybe you're still eating corn, you're still eating rice, you're still eating oats, you're still eating the processed grain, gluten-free based foods. You have to understand those foods are one of the worst things you can consume as it relates to this insulin reactivity. So don't recommend that at all, not unless you want to stay in trouble. Okay, let's talk a little bit about the sex steroid hormones. There have been a number of research studies in celiac disease. So people that have gluten sensitivity that develop celiac disease as a result of that, we actually see in the literature something that's sometimes referred to as polyglandular syndrome, meaning that many of the different glands responsible for producing hormones, including the adrenal glands, the thyroid gland, the ovaries, okay, and the testes in men, right? These glands can become broken as a result of that gluten inflammatory reactivity. Now, there's several ways this can happen, and one of it is through this celiac leads to reduced digestion absorption of food, so it leads to major malnutrition. So we get deficiencies in vitamins and minerals. You have to understand, one of the reasons I'm not a big fan of people just going to their doctor and the doctor measures the hormone and says, oh, you're low in the hormone, here's the hormone, and they prescribe you the hormone, is because understand that these hormones are made out of nutrition. They're made out of vitamins, minerals, and then what are called macronutrients. I don't know if you've ever studied this before in school or biology. Macronutrients are carbs, fats, and proteins. That's what they are. Vitamins and minerals are your B vitamins, your vitamin C, your fat-soluble vitamins like A, D, E, and K, your minerals. Vitamins and minerals are called micronutrients, meaning they're very small. Your macronutrients are your carbs, fats, and proteins. Well, understand that these are the building blocks, the fundamental building blocks to all of the hormones. So if you go in and your doctor says you have low fill in the blank, right, estrogen, progesterone, etc., but they never measure vitamin, mineral, or macronutrient ratios in your body, they never even blood test you or measure you, then they're just giving you a drug without asking the fundamental question as to whether or not nutritionally your diet is adequate for your body to be able to produce these things. Because every one of you listening to this show has the ability to make your own hormones, provided you have a diet that's conducive to good health. So gluten sensitivity as it relates to celiac causes severe malnutrition, which leads to massive vitamin and mineral deficiency, and macronutrient deficiency, especially fat malabsorption. You have to understand that cholesterol, right? We look at these three right here. Cholesterol, this is another thing. We could talk about cholesterol too. Cholesterol is the precursor. It's the mother hormone. It's the mother sex hormone. And if you are on a low-fat diet, or a low cholesterol diet, trying to reduce your cholesterol, if you're taking massive quantities of cholesterol-lowering medications, know what you're actually doing is you're setting yourself up for failure to produce sex steroid hormones, because what the drugs do is they block cholesterol, but what your diet does, it needs cholesterol in it in order to as a building block to make estrogen, progesterone, and testosterone. Now think about this for a minute. Since the early 1980s, when the first statin medications to lower cholesterol came around and were starting to be prescribed on a really regular basis, since that time, look at how we've, as a society, gone toward massive hormone deficits, right? This is such a problem that in some towns, in some cities, you actually see billboards that say low T center, right? Or hormone center, right? These are popping up, these little stores, if you will. They're little doctor stores are popping up all across the country because we've been massively depleting the mother hormone on purpose for fear of cholesterol, right? And its risk for heart disease. And what we've actually created is a side effect of hormone deficient adults. And now we're trying to medicate the side effects that were created in large part by trying to lower cholesterol or eat less cholesterol. This is a form of malnutrition, right? So we've got to have those macronutrients. Celiac disease causes vitamin, mineral, and macronutrient deficit, and so it can lead to massive changes in estrogen, progesterone, and testosterone. But there's also research, so this is one element here, the malnutrition element. There's also research that shows that antibodies, just like celiac disease, there are antibodies that attack the gut and damage the gut. We're now finding antibodies that can attack and damage hormones and hormone receptors as a result of the wrong food, as a result of eating the wrong food items. So that's just another way that gluten itself can create or contribute to hormonal imbalance. Aside from the malnutrition, we get this autoimmune polyglandular syndrome, and it's not just estrogen, progesterone, and testosterone. We can include thyroid in that. We could also include prolactin in that. We can also include the adrenal glands. And the adrenal glands produce cortisol, but they don't just produce cortisol. The adrenal glands produce adrenaline and noradrenaline, and they produce the mineral corticoids and aldosterone. So the adrenal gland is responsible for producing a number of different hormones. And actually, the adrenal glands also produce some estrogen, progesterone, and testosterone. And so again, if these are being damaged, there's a strong relationship between celiac disease and a disease of the adrenal glands called Addison's disease, which is an autoimmune disease of adrenal hypofunction. So the adrenals lose their function. Now, many of you may have heard of adrenal fatigue before. Addison's is not the same thing as adrenal fatigue. Adrenal fatigue is when you lose adrenal reserve and your cortisol over time starts to drop, whereas autoimmune adrenal disease is known as Addison's. That's when you develop adrenal hypofunction because your immune system is attacking the gland itself, and it can't keep up. It can't keep making it. And so these individuals oftentimes do. They're the ones that get put on that medication, and these are their long-term, potential side effects. By the way, this condition, I've seen it be reversed with diet change. So if you're working and you've been diagnosed with Addison's, you definitely want to talk with your doctor about the diet changes that you might be able to make in an effort to improve that. And then we have thyroid hormone. Now, I've done entire shows just on thyroid hormone, and one of the big issues with the thyroid is we know that gluten directly, so we know that gluten can directly create antibodies that impact or affect thyroid hormone. There have been well over 300 studies on this particular topic at this point. Even a lot of endocrinologists now are saying, hey, if you have Hashimoto's, which is autoimmune thyroid, we need to probably measure and look at gluten as a potential cause. So gluten, we know, can induce a hypothyroid state through autoimmune processes. Now, on the flip side to that, okay, so you got thyroid being low, we also see gluten can cause hyperthyroidism or Graves' disease. So again, we've got, Graves and Hashimoto's. Can both be consequences of a gluten-induced thyroid dysfunction. But again, we also know that there are about 17 different vitamins and minerals and proteins that are necessary to produce and regulate how thyroid hormones work and interact with your DNA. And so gluten and grain-induced malnutrition, as well as autoimmune processes, can affect the thyroid. And the last one I'll address tonight is this one on prolactin. And this is more of a rare one. A lot of people have never even heard of prolactin. But this is one of the hormones that you make, women that you make when you're breastfeeding, right? It's a hormone that helps your body get ready for pregnancy, and it helps you to know when to let down breast milk. And if you're making high levels of prolactin when you're not trying to breastfeed, this can actually pose a threat and a risk to certain parts of your physiology. And so some doctors will prescribe medications to suppress prolactin, but this is one of those things where research is showing that people many times with hyperprolactinemia or elevation in their levels of prolactin, if they go on a gluten-free diet, a lot of times what can happen is the prolactin levels normalize as a result of a gluten-free diet. And I've seen this happen a dozen times or so. Again, this is not a super common situation, but I've seen this happen in my own practice at least a dozen times in women where they had a diagnosis of hyperprolactinemia that was resolved as a result of identifying a gluten sensitivity issue and getting them on a gluten-free diet. So we've got a lot of different ways that gluten can impact a lot of different types of hormones in summary. And so I'm going to open it up for questions because I know this is probably one of the most question-laden topics that we get when you guys write into us. So let's dive into those. Let's see. If intracellular iron levels are optimal, would ferritin levels decline or be below normal? So there's no such thing as measuring intracellular iron. There's no test that actually measures intracellular iron. So that question actually is a little bit misleading, Juan. You can measure serum iron. You can measure ferritin, which is a measure of stored iron in the liver. Those are the big ways that you can measure iron. And then you can measure iron somewhat indirectly by looking at hemoglobin, hematocrit, mean corpuscular volume, and mean corpuscular hemoglobin concentration. Those are typical markers on a red blood cell indices or on a complete blood count. So when your doctor runs what's called a CBC, those markers are generally there. And so you can learn a lot about iron from those particular markers, but there's no intracellular iron test that can be done. Let's see here. So Victoria wants to know, I know you said not to eat lectins in your book, but what about various lentil pastas, safe or not? Depends on where you're at, Victoria. The whole issue with lentils and lectins and beans, so lentils, let's just put beans, and we have these lectins, and lectins are plant proteins. They're century plant proteins. They're designed to help preserve the life of the plant to prevent predators from eating the plant to extinction. And so what happens is a lot of people, when they're first going on that no grain, no pain diet and lifestyle, their guts are compromised. So they have a compromised gut, meaning that lectins can penetrate through into the bloodstream. And when that happens, they can wreak havoc systemically, creating joint pain and inflammation. If you don't have a compromised gut, in essence, if you don't have a leaky gut and your gut health is really great, you're having bowel movements 1 to 2 times a day and they're well formed and normal and there's no blood in your stool and you don't suffer with indigestion or digestive problems, then that's a strong indicator that your gut's not compromised and you might be able to tolerate beans and lectins just fine. However, that being said, I wouldn't use beans or lentils specifically unless they were properly prepared. So pressure cooked so that there's no crunch. You should never eat a bean and get a crunch. That means they're undercooked. That means the likelihood that these guys here are much stronger and going to create more of an issue is much higher. Raw beans are a bad idea. Poorly cooked beans are a bad idea. What you can do with lentils and beans is you can soak them. Generally speaking, anywhere from 24 to 48 hours of soaking, where you soak them for 12 hours, drain them, soak them some more, drain them again. So drain them and soak them 3 to 4 times, up to 48 hours, depending on the type of bean. What that helps do is it helps wash some of this away. And then when you pressure cook them or use high temperatures to cook them down so that the bean is more mushy as opposed to crunchy, then what you're doing is you're breaking down more of these lectins and other plant compounds that can be problematic for your digestive tract. So that's hopefully answers your question on lentils and beans and why I have people avoid them, especially in the first couple of phases. That first 30 days is critical to avoid them. But really, in my clinical experience, the first 6 months is really what you want to do to get a solid foundation where your GI tract is working really, really well. And some people have to go even longer because of the gluten-induced damage, the long-term damage to the GI tract that has led to some scarring or some potential flattening of the villi within the GI tract. And those individuals oftentimes can never bring these back in. So it just depends on who you are and what your outlook is there. Let's see here. Mary says, I found out I had celiac sprue when I was almost 39, and I know that I've had it since I was, oh, okay, not a question there. What, in addition to gluten-free, low-carb diet, can help reverse insulin resistance? Oh, great question. So one of the things is chromium. So micronutrients, what we didn't do here is I didn't tell you the biochemistry behind this diagram. So, for example, aside from food, right, you can change your food. Well, what can you change in these 6 steps here? Well, step number 2, this step requires vitamin D. So how can we get more vitamin D? We can eat mushrooms, we can get more sunshine, right? We need vitamin D because in order for glucose to talk to your pancreas, that occurs through vitamin D receptors. You need vitamin D to do that. Step 3, insulin, is the production of insulin, which requires the micronutrient magnesium. It requires zinc. So you need zinc and you need magnesium to properly produce insulin. Zinc actually holds insulin together. So if you don't have adequate zinc, what happens is you produce insulin that doesn't work very well. It's not as effective. This receptor, this insulin receptor, is made out of chromium and niacin, which is vitamin B3. Okay? And so if you are B3 deficient or chromium deficient, then what will happen is your insulin receptor won't work very well. And so you can make all the insulin you want, but think of insulin as a key. Think of this insulin receptor as the keyhole on the door. And if you have a key, but there's nowhere to put it, right, then you're still out of business. And if you have a keyhole, but you don't have a key that works, then you're still out of business. So these two things are equally critical, the chromium, the niacin, the magnesium, the zinc. Then we have this, what's called intracellular communication. This is where, those of you who studied biology or biochemistry, if you ever remember hearing your professor talk about what's called a second messenger, calcium is a second messenger, one of the most prolific ones. So calcium actually helps to deliver the message. So once that chromium forms that insulin receptor and insulin docks here, it sends a message through the cell, and calcium is who delivers that message. So again, you're asking me, what else can you do to improve your insulin sensitivity? You make sure your calcium levels, your chromium, your niacin, your magnesium, your zinc, your vitamin D, you can make sure those levels of nutrients are adequate. This is why you guys hear me talk about this a lot. Get your nutritional status evaluated. It is fundamental. And if you don't start there, it doesn't matter what drug you take. All it's doing is serving to alter, manipulate your biochemistry in a way that's favorable at suppressing your symptoms without addressing the underlying reason your symptom exists. And that's, to me, it's an effort and it's an exercise in futility. Once we get here, so last thing, so this requires, the energy production part requires CoQ10 and B vitamins and copper and iron, and it requires vitamin C. Like, those are the main nutrients that are required to generate the energy. Once we get the glucose into the cell, to generate the energy, we need these nutrients in mass. So those are things you can do. The other thing that you can do to improve your insulin sensitivity and your glucose outlook is exercise. Maintaining good, proper muscle mass. Because the more mass you have, muscle mass increases production of the insulin receptor. So that insulin receptor, the more muscle you have, the more of these receptors you have, and the better those receptors work. And when you have a lot of receptors that work really well, your pancreas doesn't have to work as hard at making so much insulin. So your pancreas can kind of cruise as opposed to struggle working to try to keep up with the demand. So build your lean muscle. You don't have to become a bodybuilder, but lean muscle, Tabata style workouts, high intensity interval training with minimal weights. You just really need body weight exercise to really build lean muscle, but you have to be consistent and show up every day to get it done. Let's see here. Larissa, if I'm hypothyroid and don't have Hashimoto's, will gluten still affect my thyroid directly? Possibly. If you're gluten sensitive, it very well could. A lot of people have a hypothyroid and they've never been diagnosed with Hashimoto's just because the doctors never run the antibody test. So it might depend on how you were diagnosed with low thyroid. If your doctor never ran antibody tests, you might not even know that you have Hashimoto's. If he did run them and you didn't have it, can gluten affect them? In time, it can. It's not necessarily that you eat gluten once and then you automatically have high thyroid antibodies. For many people, it's the gluten exposure year after year after year that leads to the buildup of antibody production. Let's see. Donna says, I don't have a kitchen at the moment. It seems almost impossible to be gluten-free while eating out. Any suggestions? Yeah, I mean, if it were me, like when I find myself without a kitchen directly, if I'm traveling or something along those lines, I pick up easy foods, things like fresh fruit, fresh vegetables, and make a salad. So like I can take some pumpkin seed and some like chard and some spinach and I can even, if you're talking about unavailability, there's certain stores where you can buy like chicken breast, cooked chicken breast, with just cooked in olive oil and salt or garlic or something like that. And you can put that over a salad and just get real stoic about your diet. It may not taste as good as it would if you were at home cooking, but when I'm traveling and on the road, that's what I do. I eat a lot of jerky, I eat nuts, and I'm just a little bit more stoic about my diet, knowing that when I get home, I'll be able to get more of that flavor. But you know, when you're limited to whether or not you have a kitchen, that can be tough. Let's see. Barbara wants to know, is the Dutch test a good starting point to evaluate hormones? No, a Dutch test is not a good starting point to evaluate hormones. It's a good secondary point. It's a really good question because you want to evaluate hormones. The best way to evaluate hormones is to evaluate this. Okay, because what did I say earlier? Hormones are made from these things. And if let's say you get a Dutch test and your cortisol's abnormal or your estrogen's abnormal, what's the next question that you should be asking? You should be asking, why is my hormone level abnormal, right? And the Dutch doesn't tell you why. It tells you that it is normal or abnormal, but it doesn't tell you why. So what you really want to know are these things, right? Because these things will help you to understand the chemistry of whether or not you even have the nutritional chemistry to be able to produce your own hormones. So this would be the primary way I would say it's important to evaluate your nutritional status to know whether or not you even have the capacity to make your own hormones, because otherwise the Dutch is just going to lead some doctor to want to prescribe you hormone therapies or supportive therapies that don't address the underlying reason why your hormones might be abnormal. Can hereditary hemochromatosis make the effects of gluten intolerance worse? Yes, it can. It can, because hemochromatosis is, you get an elevation of iron, and that's very inflammatory. So you compile that with the inflammation caused as a result of gluten exposure, and you've got two things damaging you instead of one. So if you're gluten sensitive and your diet's gluten-free, then no, it's not necessarily going to impact that. It'll only impact you if you're not adhering to your diet. How long do you have to hold supplements prior to testing for nutritional deficiencies? You mean how long do you have to hold off on taking supplements? I'm going to assume that's what you meant, Sharon. You don't if you do the right testing. So this goes back to methodology. A lot of doctors want to do serum tests. Serum tests aren't super accurate for nutritional status because they're a reflection of your last meal or your last stressful drive in the car, right? So we don't want a test that's going to give us like a snapshot. We want a test that's going to give us like this really long window of time. Just like with blood sugar, doctors use hemoglobin A1C to measure your blood sugar average over time. We want to do that same thing with nutrition. This is why we look at intracellular levels. So again, talk with your doctor about intracellular versus serum levels, and that will be very helpful to get an assessment. And if you're doing an intracellular test, you don't have to stop taking your supplements to get an accurate result. You stay on your supplements, and this test will show you how well they've been working. Did they work? Right? Are your supplements, if you've been taking zinc for 6 months and you're zinc deficient, you can look at your bottle of zinc and probably say, this is probably not a very good product, or there's something else going on that's preventing me from absorbing the zinc in this product. Okay, so Jennifer's asking, she says, I'm hypothyroid and adrenal and cortisol depleted. I'm taking adrenal supplements. Her question is, can taking T3 be a problem? I take nature thyroid and I get fatigue. I also take iodine. It depends, Jennifer. That's kind of a pretty complex question because there's a lot of other variables and factors that could go in. I could ask you another 100 questions based on that question that you're posing to me. But the simplest way to answer it is, yes, T3 can be a problem if your cortisol's low and your adrenal glands are fatigued. T3 is like, think of your adrenal glands as a very tired horse, and you've got your boots, your spurs on, and that horse is ready. It's done riding for the day, but you just keep spurring it on. Eventually, it's going to collapse, and that's what T3 does to the adrenal glands. It pushes the adrenal glands. So if the adrenal glands can't meet the demand then it can actually have the antithesis of the effect that you're looking for, which is if you're taking your thyroid medication and it's wiping you out or exhausting you, then you might want to talk to your doctor about making some changes along that line, because it can overwork your adrenal glands, and if your adrenal glands are already overworked, it can exacerbate your problem and you won't feel better. So Kimberly wants to know, would I eat grass-fed elk that's been fed minimal oats as well? I think you have to define minimal oats for me to give you an answer to that question. If there was an occasional feeding of oat, I probably wouldn't look at that as any great risk to my health. However, if, like on many of these hunting acreages where you can go and hunt, a lot of, like here in Texas, they put out corn feeders, and they're spinning corn, genetically modified corn, all over, and the deer are just up there eating during deer season. That I would not eat. So it just depends on what you mean by minimally fed oats. Let's see here. So Mary says, with having celiac disease, I have osteoporosis at a young age. The doctor wants me to take a pill to make my bones stronger. Should I take it? Well, first of all, I can't give you medical advice, Mary. This really is a question for your doctor, but I can say, and maybe we can put a link up to one of our past shows for you on, it's called Bone Scan Myths. And I think, Mary, best place to start would be to watch that video to get a good idea for the answer or the education that I think you should have, so that you can have an intelligent conversation with your doctor before just being told to take a pill. Because a lot of those pills don't strengthen your bone. They make it look better on a bone scan, but they actually make your bone more brittle. That's why one of the long-term side effects of taking the bisphosphonate class of medication is they cause microfractures of the jaw. And you don't want that. That's called osteonecrosis of the jaw. You don't want that, because then you won't be able to chew your food. And when you can't chew your food, you become even more malnourished and your bones deteriorate even faster. So, have that conversation with your doc and watch that video. Let's see, Van, what's the best food to keep the calcium phosphate ratio in favor of calcium? Lots of foods. I mean, maybe be more specific about what else you're trying to achieve. I'm not even quite sure what you mean, because you have to understand that there's calcium and phosphate in a lot of the foods that you eat, and it's not, if you're eating natural foods versus, let's say, supplementing, you're not so much worried about a favorable ratio in the favor of calcium. Butisse wants to know, can DNA gluten test be used for testing vitamin and mineral deficiency? No, so gluten DNA test is only going to tell you whether or not you're reactive to gluten, but it's not going to give you a definitive on whether or not you have nutritional deficiency. Now, if you are reactive to gluten and you're struggling in your health, then there's a strong likelihood that you'll have gluten-induced malnutrition, but the test itself is not going to tell you what vitamins and minerals that you are deficient in. Let's see, Stephanie wants to know, why does free T4 show low? That's your issue. So there's a lot of reasons why T4 can be low. If we look at it from a nutritional perspective, so again, if we're talking about vitamins, minerals, macronutrients, T4, if we just break the chemistry down, the 4 equals iodine. The T is tyrosine, which is an amino acid. And so some people don't get enough tyrosine in their diet. Some people don't get enough iodine in their diet. Your body will take tyrosine and 4 molecules of iodine, and it will put them together. Now, to do that, that requires vitamin B2, and it requires vitamin C. So you need vitamin B2, and you need vitamin C to build T4. Okay, so a lot of times when T4 is low, it's because you don't have one of these nutrients. Very, very common. Another reason why T4 could be low is that your gluten, you're creating antibodies that are attacking your T4, and your body can't meet the demand or continue to produce. So, those would be some of the more common reasons why T4 might be low. Let's see. Addie wants to know, can you discuss the correlation between heat intolerance and gluten sensitivity and autoimmunity? So if you're intolerant to heat, there's a lot of reasons why you can be intolerant to heat. But one of the biggest, there's actually a couple different actual autoimmune conditions. One is called erythromelalgia, which is where gluten can damage the valves in the blood vessels. And when gluten damages those valves in the blood vessels in the blood, gets stuck and it pools, and you can become intolerant to heat. For that reason, you can become intolerant to heat as a result of systemic nutritional deficits. So nutrition, remember, part of how we regulate our temperature and regulate our ability to adapt to any environment is going to be largely through our nutritional status. And so again, gluten, one of the biggest ways that gluten impacts people and creates or triggers autoimmune disease, aside from an immune response directly, is through malnutrition. It causes malnutrition, which makes the body struggle to maintain doing what it's supposed to be able to do, what we call homeostasis, where the body has this ability to regulate temperature and to regulate movement and sleep and all these things you don't have to think about. You don't have to think about when your heart beats or how fast it beats. It just happens, right? That those homeostatic mechanisms are largely under the influence of these nutrients. And so again, if you are malnourished as a result of gluten exposure, that definitely could be one of the reasons why we're struggling with heat. Let's see. There's also demyelinization issues that can occur with heat intolerance. So like B12 deficiency, which is the second most common deficiency in gluten sensitivity, can cause demyelinization of your nerves, leading to a change in the way you perceive temperature, which can cause inability to tolerate heat very well. We see that oftentimes in people that develop multiple sclerosis. Let's see. What does it mean when the good cholesterol goes up with the bad cholesterol? Nothing. I would say that if you don't understand that there's no such thing as bad cholesterol, then I would encourage you, Ellen, to go back and watch. I've got a really good video on cholesterol that I think would give you a lot of better insight than what we have time to answer very briefly in tonight's show. So I would encourage you to go, and if you don't already, subscribe to my YouTube channel and just type in cholesterol on my channel in the search box, and you'll pull up several shows that I've done in depth on cholesterol, because it's going to require a lot more time than what we have tonight. If you think you developed gluten sensitivity because of poor diet, nutrition deficiencies, with a genetic test still be the test to take to confirm the sensitivity? You don't develop gluten sensitivity because of a poor diet. You either are gluten sensitive genetically or you're not. So understand, gluten sensitivity is not a disease, it's a state of genetics. You either have the genes or you don't have the genes. Now, for some people, the actual symptoms of gluten sensitivity develop later in life for different factors. So for example, if you eat poorly and you're malnourished, you might manifest the symptoms of gluten sensitivity earlier in your life as opposed to later in your life as a result of you being malnourished. If you don't exercise, if you eat poorly, if you have a history of taking a lot of antibiotics and a lot of other medications that affect the GI tract, then you're going to increase your risk of developing the symptoms of gluten sensitivity earlier in life as opposed to later in life. Because gluten, for most people, it takes about 3 decades for women, 4.5 decades or so for men to really start seeing the symptoms manifest badly enough, like severely enough, where they make a trip to the doctor to try to learn what's going on with their bodies. Let's see. Amanda says, what can I do to help with low libido after cutting gluten out? So if you're, now let's clarify, Amanda, are you following a gluten-free diet, a traditional gluten-free, or are you following no grain, no pain? Because if you're not here, this is what else you can do. Phase 2, no grain, no pain diet, okay? Beyond that, check especially your nutrient status, especially checking nutrients like inositol and zinc and magnesium, because these are very, very critical for hormone. Those nutrients are very critical for hormone regulation, and again, low libido related to hormone dysfunction. You could have some nutritional deficiencies that are playing a role in that low libido. Let's see, Janet says, would like to get rid of hot flashes. Have incurred for almost 12 years, had amalgams removed last year, and started heavy metal chelation last year with a layover with COVID. Lost 15 pounds of the 35 I put on with removal of all grains. So I guess the question is, how can you get rid of hot flashes? Really, with that, you've got to identify the underlying reason as to why they exist. And for many, if you're not really truly going through menopause, then there's something else. There's another toxic burden that you're probably struggling with. So working with that same doctor, that you sound like you're working with a doc already, to help understand what other toxic burden you might be working with would be what I would strongly suggest that you do. Victoria says, what tests do you recommend to get the proper understanding of whether or not you have a gluten sensitivity issue? Genetic testing. Can we throw up a link for genetic testing for Victoria on Facebook? She's interested in learning a little bit more about that. Okay. Is it normal to still have hot flashes with a partial hysterectomy? Wow, 8 years ago. Have all these symptoms you mentioned? No, it's really not. Something else is going on, Dory. Again, I would look to everything that we talked about tonight and just going in and having a deep conversation. Now, I said earlier in the beginning of the show tonight that I was going to put a link up to a very in-depth and very well-researched article. It's about a 2,000-word article, but I'm linking to all the different research studies based on what we're talking about here tonight. So if you want to have an intelligent conversation with your doctor and you want some evidence to take in with them, make sure you go visit Gluten-Free Society. That link should be up. Mel, can we put that? I put it up, I think, already on Facebook or on YouTube, but I didn't put it up on Facebook. But go check out that link, because that's where all these medical references and research studies are going to be listed out for you as well, so that you can have that information to have that conversation. So Kimberly comes back and says, no corn, just non-GMO oats. However, mostly grass is fed to the elk. So going back to the elk question, again, then I would just go down to quantity. Is it daily? Because if it's daily use, I wouldn't. That wouldn't be something I would consume. The whole premise of eating wild game is that you're getting a really high omega-3 to omega-6 ratio, and that you're alleviating a lot of the marbling in the meat that those grains can cause. And it's that type of fat that's been linked to heart disease, not animal fat, but again, improper animal fat when grains are used to fatten up animals. But again, you have to make that call based on how much quantity-wise those elk are actually eating. Okay, I think we're out of time. Still got more questions, but we're going to have to wrap it up. So thanks again for sharing your Monday with me. I hope this was helpful. As a matter of fact, this was helpful. Give me some thumbs up and let me know that you guys appreciate and that are learning from what we're publishing for you. And make sure, too, that you come by and visit me at glutenfreesociety.org. Drop your name and email there. We'll send you a ton of wonderful free information about how to navigate a true gluten-free lifestyle. And if you aren't sure about gluten, not sure whether or not you need to go gluten-free, check the link out below. There's a free quiz that you can take. And within that quiz, you can get kind of an answer as to whether or not you need to further investigate the potential possibility of whether or not gluten is playing a role in your health issues. This is Dr. Osborne wishing you an excellent week. We'll see you next Monday night, same time, 6 p.m. Central Standard. Have a fantastic evening.